So the second cause of spinal cord compression is extramedullary and intradural. The third cause of spinal cord compression is intramedullary. That is inside the parenchyma, and intradural. Is it clear? So those are the three major causes under which we have spinal cord compression. Under extradural and extramedullary is any pathology of the bones. Is it clear? So the pathology of the bones and the disc. The pathology of the bone is called inflammation of the bone is called spondylitis. The second one is the inflammation of the disc. Is it clear? Which is called the discitis. Is it clear? You can have inflammation of both, which is spondylodiscitis. Is it clear? Particularly, you have spondylodiscitis when you have Pott's disease. Is it clear? The tuberculosis of the vertebral column. Is it clear? Now, after the spondylodiscitis, so those are the major ones. You can have others like the disc prolapse. Is it clear? Disc prolapse. Is it clear? Can also affect extradural and extramedullary. The next one after the disc prolapse, we have also what? So you have a disc prolapse that you have also to put in mind. Is it clear? So disc prolapse. So those are the different elements. After the disc prolapse, you have also the shift of the disc, like the slipping of the disc in the case of a spondylolisthesis. Is it clear? Spondylolisthesis. Spondylolisthesis is a displacement of a vertebral the spondylolisthesis is a displacement of the vertebral body. Is it clear? Of a vertebrae. Is it clear? Either anteriorly or posteriorly. Anteriorly is called a anterograde spondylolisthesis. Is it clear? And posteriorly is a retrograde spondylolisthesis. And posteriorly is bad because it can compress the spinal cord, which is behind. Because you need to know that what the spinal cord is directly located behind the vertebral body. Is it clear? The body of the vertebrae, and it is anterior to the spine. So when it is shifted, it is mostly the vertebral body that is shifting. Is it clear? So those are the causes which can be extramedullary and extramedullary. Now the causes which are extramedullary and intradural is any pathology affecting the like epidural abscess. Is it clear? If you have epidural abscess at the level of the disc or of the spinal cord, you have epidural hematoma. Is it clear? It can be extradural, it can be intradural, extramedullary, epidural hematoma. Now, or you have also any problem affecting at the level of the ganglions, particularly the dorsal root ganglion, like in the case of cancer, it's called gangliomas. Is it clear? Or you have also neurofibromatosis, because neurofibromatosis affect the nerve ganglions. Is it clear? Neurofibromatosis can also affect at this level. Now, the next one is intramedullary and intradural. Intradural, now we have mostly malignancy inside the medulla. We first have even intramedullary, intradural, we have malignancy which is located there. We have things like astrocytoma, which are cells there. You have astrocytoma, that's the first one. You can have the cases of the swelling of this. Is it clear? Like in a stroke, you can have a stroke of the spinal cord, a spinal stroke. Is it clear? Resulting to a swelling of the spinal cord. Is it clear? If you have any cause of a swelling of the spinal cord, it can also be associated with that. Is it clear? And also in intramedullary, intradural, it is not, you have intramedullary, intradural, we have another one which is transverse myelitis. Is it clear? But transverse myelitis is the most common cause of non-compressive spinal cord injury. Is it clear? It is instead non-compressive. Is it clear? So those are the different elements that you have to put in mind. But now let's come back to our neuropathy. In neuropathy, you need to know that what the extramedullary intradural and the intramedullary intradural are not going to be considered as causes of the spinal root disorders, because the spinal root is out of the dural mat of the spinal column of the spinal cord. Is it clear? So it means that all the intradurals are not going to be under the causes of the nerve disorders. So under the cause of nerve disorder, you can have a spondylitis, you can have a discitis, you can have a spondylolisthesis or a spondylodiscitis. You can have like in the case of a Pott's disease. Is it clear? You can have a disc prolapse, you can have a spondylolisthesis, you have a traumatic spinal cord, a spine injury. You don't say traumatic spinal cord injury, it's traumatic spine injury. Is it clear? So those are specific causes, local causes that you can have them. Now, other causes that you can still have at the level locally at the level of the nerve root. We have the next one, you have things like locally at the level of the nerve root. Is it clear? You have other things like one, which is going to proliferate only on one nerve. Is it clear? Particularly affecting the nerve. Is it clear? So it's better that I'll explain. So these local causes is mostly based on the vertebra. Is it clear? Now the next pathogenesis now is going to be the pathogenesis of the nerve bulk. Is it clear? And the pathogenesis of the nerve bulk are mostly coming away from the vertebra. The pathogenesis under the spinal root are coming as a result of the local causes from the vertebra, and we have listed them all. Now the pathogenesis of the nerve bulk are coming away from the vertebral column, so they are systemic. Under those systemic, we have pathology that are going to directly enter on the nerve. Is it clear? We have pathology that enters directly on the nerve, and we have other systemic pathologies. Is it clear? So what do I mean by that? So in the pathologies of the nerve bulk, is it clear? You need to know that there are certain microorganisms that is going to affect a particular nerve. Is it clear? So there are pathology that penetrate directly the nerve. They have a nerve disorders, and we have other systemic pathology that affect multiple nerves. Is it clear? There are pathology that affect only a single nerve, and there are pathology that affect multiple nerves, which are more systemic. Are you understanding? Now, pathologies that affect single nerves are usually microorganisms that penetrate one nerve. Like one, we have poliomyelitis. Is it clear? Poliomyelitis is going to cause both an upper motor neuron syndrome and a lower motor neuron syndrome, because it is affecting first the nerve that is penetrating into it, then it goes to a central nervous system, affect the central nervous system, resulting to a upper motor neuron syndrome. So you have poliomyelitis, which can result to a nerve or a nerve bulk disorder. The second one, we are going to have a herpes zoster. Is it clear? Herpes zoster. Herpes zoster affect only one particular nerve bulk. Is it clear? The next one, you have Lyme disease. Is it clear? Which is caused by Borrelia burgdorferi. Is it clear? It's caused by Borrelia burgdorferi. Is it clear? So this is a microorganism that is also going to penetrate the nerve and affect particularly one nerve root. Is it clear? Or one nerve bulk. Is it clear? So that's Lyme disease. So the nerve bulk disorder can be on one particular nerve, or it can be on multiple nerves. These ones are the ones that affect particularly one nerve. Now, the next one now are the systemic manifestations. Is it clear? The systemic disorders, you can have one, the mechanism can be via autoimmune antibodies. Is it clear? Autoimmune antibodies, like in the case of the Guillain-Barré syndrome. Is it clear? Like in the case of Guillain-Barré syndrome. When you have Guillain-Barré syndrome, it can also be a problem of a nervous disorder. Is it clear? Of a systemic nervous disorder. Generally, you need to know that when Guillain-Barré syndrome, it is first associated with a gastroenteritis within the first days, caused by Campylobacter jejuni. Is it clear? Campylobacter jejuni. And now autoantibodies are going to be produced in the body against this Campylobacter jejuni. Is it clear? And then they are going to cause systemic nerve disorder. Is it clear? Guillain-Barré syndrome. The next one after the Guillain-Barré syndrome, we can have also diabetes. Like in the case of diabetic nephropathy, diabetes can also affect the nerve systemically via the what? It systemically can affect the nerve via the enzymatic pathway, where you are going to have sorbitol accumulation, and that is going to result to a lack of action potential activation. Is it clear? So that is the next step, that is diabetes. Now we have other autoimmune disease disorder that can be associated. Is it clear? Now centrally, there is a disorder that is affecting only the motor neurons. Is it clear? And that is a disorder called a motor neuron disease. Is it clear? Motor neuron disease. So it's also a neuropathy type. In a type of neuropathy, it is a motor neuron disease. Is it clear? Motor neuron disease are affecting the body at the level of the spinal cord, only on the motor neurons. Is it clear? So it's affecting those nerves, but not directly on the spinal cord, but at the level of the spinal cord, only on the motor neurons. Is it clear? So example of this motor neuron disease, you have amyotrophic lateral sclerosis. Is it clear? Amyotrophic lateral sclerosis. So those are the different etiologies that you can have in neuropathies. Is it clear? Now after the etiologies, we need now to visualize the pathophysiologies of this.